okay?
I'm Olivia Smith. I'm a student physical therapist from the University of Michigan, Flint, and your doctor sent me to do some physical therapy with you. Does that sound okay?
Sure.
So I'm just going to ask you a few questions. We'll see how you're moving. So first, before we get started, what is your name and date of birth?
Shirley Jones, 12/31/1969.
Okay, let me check your wristband. Okay, looks like I am in the right area. Do you know why you're here today?
My niece found me yesterday at home. I was confused. Didn't really know where I was at.
Okay. So, you were scheduled for dialysis yesterday and you didn't go.
Right.
Were you feeling confused then, or you just didn't feel like going? What was kind of going on there?
I think because I missed it, I don't know. I really don't know what happened.
Okay. Alright, so, kind of what happens when when you're able to go to the bathroom, your body can get rid of waste and toxins, and so that's what dialysis does for you. So it takes those waste and toxins, gets them out of your body. So when you miss a day at dialysis, that kind of builds up. And so that can cause a little bit of that confusion. It can cause some fluid buildup in your lungs in some cases. So that might be what kind of went on with you and kind of got you here. Okay? So in the future, do your best to not miss an appointment. If you do feel like you need to miss an appointment, call your doctor and talk to them about it, okay?
Okay.
Okay. Were you just feeling a little bit down yesterday, or?
No.
No? Okay, so you don't have any sort of like depression going on or
No.
anything like that? Okay. Alright, so how were you doing before you were admitted yesterday?
Good.
You were walking on your own?
Yeah. When so before COVID, I walk on my own, but before COVID, if I went to Walmart, I would use one of their ride carts.
Okay.
And,
Yep, the little scooters.
just because it helps with the grocery shopping a little bit faster. But since then, my niece has been shopping for me.
Okay. So when you're walking around, do you use like a cane or a walker?
Nope.
No. Okay. Just a scooter when kind of like longer distances, carrying things?
Yeah.
Okay. Were you having any trouble with stairs prior to coming in here?
No, I don't have any stairs where I live, so.
Okay. Were you driving?
No. No, there was a company that would transport me to, they would come get me for my dialysis treatments.
Okay.
So I didn't have to worry about that.
So how often are you going to dialysis?
I go Monday, Wednesday, and Friday. So 3 times a week.
Okay. So were you doing all the cooking and cleaning and that sort of thing in your...
Oh, yeah.
Okay.
Yeah, I do all that.
Okay. Do you live in a house or an apartment?
It's an apartment for senior citizens.
Okay. What floor is your apartment on?
The first floor.
Okay.
So, yeah, I don't have to worry about stairs.
Are there any steps to get into the building?
Nope.
No. Okay, that works. Huh? Pretty easy?
Yeah.
Is the laundry also on the first floor? Do you have a unit in your home or in your apartment?
Yep, it's on the first floor. It's down the hall, though. It's not in my unit. We share it.
Okay. Do you have any issues with getting your laundry to the laundry room?
No, I have one of those rolly carts. It's on wheels, and I just, slide it down there.
Okay. That works. Do you work?
No, I'm on disability right now.
Okay. Where did you work when you were working?
I worked at the hospital as in the nursing home facility, as a CNA.
Okay. So what can you tell me about your past medical history? I know you're doing dialysis, so you've got that renal disease going on.
Yeah, I have hypertension, and then of course my dialysis, which is, you know, that kidney stuff going on too. So, but the nurse has all that. That my niece gave that information.
Okay. Have you had any recent surgeries?
Just for my port, for the dialysis.
Okay. And so the nurse has all your meds and stuff in the system too, right?
Yes.
Your niece got her that? Okay.
I think so.
So what are some things you enjoy doing?
I like just living independently and, you know, visiting with my neighbors, and, I don't do a whole lot of physical activity, but, you know, reading and things like that.
Okay. What are your goals for physical therapy?
I just want to go back home.
Okay. Okay, so I'm going to check your vitals, and then I'll do some listening to your lungs. I'll check your sensation, and then we'll do a little bit of walking around. Does that sound okay?
Okay.
Okay, what's your pain level right now?
I don't have any pain.
0 on a scale of 0 to 10? Okay.
Yeah.
All right. So I'm going to give you this for your pulse ox. And then which arm is that port in?
It's in my right.
Okay, so is it okay if I check your blood pressure in your left arm?
Yeah.
Go ahead. (116/64). I'm gonna write that down before I forget it. Okay, and let me take this from you.
Okay.
Okay, so your pulse ox is 98 on room air, and that's normal. And your heart rate is 74 beats per minute. Okay. All good. Those are all good things. I was going to ask too, do you have any issues with taking your medication at home? I know that's a few meds to keep track of, so do you have a system to kind of do that?
Yeah, I have one of those day containers, you know, and my niece helps me put them in there.
Okay, perfect. Okay, I'm going to listen to your lungs a little bit, okay? So just sit up tall and breathe when I tell you to breathe deep. Okay, breathe deep. Breathe deep. I'm going to go right on your skin if you don't mind, okay?
Okay.
I'm just going to reach in here.
Mm-hmm.
Okay, breathe deep. Breathe deep. Again. There, I can hear a little better there. Again. I'll be reaching right down in here, okay?
Mm-hmm.
Again. Again. Okay, I'm gonna go up through your shirt to get a couple spots right below your chest, okay?
Alright.
Okay, breathe. Breathe deep. Okay, last one on each side. Breathe. One more. Okay. I'm going to have you, I'm going to listen 4 more times, just kind of in your upper chest region. And when I listen, I want you to say E, E, E. And I'm just kind of listening for that transition of sounds through your lungs.
Okay.
If it's a different noise, then that kind of tells me that there might be some fluid in your lungs. If it's the same, we don't have anything to worry about. Okay.
Okay.
Say E, E,
E, E, E, E.
Okay. And this side?
E, 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 E.
Okay. This side?
E, 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 E.
One more.
E, 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 E.
Okay. All normal. That's very good. It's a very good sign. Okay, I'm going to check your sensation in your upper extremity. So I'm going to have you put your hands like this and then close your eyes.
Okay.
I'm going to bring this up a little bit.
Yeah.
Okay. Can you feel that?
Yeah.
Where am I touching you?
On my left hand.
Okay. You feel this?
That's on my right hand.
Is it on your hand or your finger?
My finger.
How about this one?
My right hand.
How about this one?
Left arm.
How about this one?
Left pinky.
Good job. Okay. I'm going to have you squeeze my hands
Uh-huh.
as hard as you can. Squeeze. I can take it.
Uh-huh.
Squeeze, squeeze, squeeze.
Uh-huh.
Okay. Alright, I'm going to check your sensation in your lower extremities. So I'm going to lift your pants up here a little bit. Okay, close your eyes. Where am I touching you?
Left foot.
Inside or outside?
Inside.
How about now?
On the other side.
How about now?
On my right foot.
How about now?
My right toe.
Which toe?
Pinky.
How about now?
On my right leg.
Okay. I'm also going to listen for, check your pulses. So go ahead and bring one leg up. You can rest it right here. These can sometimes be hard to find. Oh, there. Okay, so that one's a little bit weak. This one out. It's not abnormal. Sometimes that is the case. This one's equal to the other side, which that's good, but it's also a little bit weak. I'm just going to write that down. Okay, so now I'm going to have you bring your right arm up and over your head.
Okay.
Okay, and then back down. And then bring it back up to like 90 degrees.
Like here?
Yep.
Okay.
And then when I push, try to hold it there.
Okay.
Okay. And then bring it out to the side. As high as you can. You get some shoulder pain?
Mm-hmm.
Okay, then come back down to about 90. I'm going to push, hold it here. Okay. So then I'm going to have you make a muscle right here.
Okay.
And then I'm going to pull out. Don't let me pull you out, okay?
Don't let you?
Don't let you.
Okay.
Hold it there. Okay. And then we're going to do the same thing on this side. So bring it right in front of you as high as you can. And then come right down to about 90 degrees. Yep. Hold it there. Don't let me push you down. Okay. Then go out to the side. Like this. As high as you can. And then come back down here. Okay. Don't let me push you down. Okay, then make a muscle. Don't let me pull you out. Okay. Are you feeling kind of tired today?
No, I'm fine.
So now I'm going to have you bring your hip up towards the ceiling. Or your knee.
My knee?
Yep.
Okay.
Okay, hold it there. Don't let me push you down. Okay. And then this one. Don't let me push you down. Okay, then straighten this leg out. Okay, hold it there. Don't let me push you.
Okay.
And then hold your thigh, or hold your leg where it's at, and don't let me pull your leg out.
Okay.
Okay, then kick this leg out. Alright. Okay, don't let me push you down.
Okay.
I'm gonna pull, don't let me pull you out. Okay.
Okay.
Okay, and then bring your toes up towards the ceiling.
My toes?
Yeah. Yep, and then don't let me push down. Oh, okay. Don't let me push down. Okay. You got a little bit of weakness. That could be from just missing that dialysis treatment, kind of being in bed, feeling not like yourself. So I imagine that'll come back in a couple days. We'll work on it. But it's super important to stay mobile, especially when you're at home. I know you said you like to do a lot of reading and things like that. But maybe thinking every hour, just try to get up, walk around, even just walk down the hallway and back. That really helps just keep things moving and keep your body just feeling better and keep that strength up. Which we need that strength to do almost everything. So, very, very important. We're going to try some walking. Speaking of walking, get some socks on you. And I see you already have your gown on.
Yeah.
Oops. You didn't feel like laying down today?
No, I just had breakfast, so I just stayed sitting.
Yeah, I don't think I wouldn't want to be laying down either. Okay, go ahead and lift your arms. Okay. So I know you don't use an assistive device at home, but I am going to have you use the walker. So how tall are you?
About 5'6".
Me too. We're just going to walk around and then we'll sit in that chair.
Okay.
And then I'll take your vital signs again, okay? Just to see how they're reacting to moving. So when you stand up, I want you to push off the chair, push off the bed,
Okay.
and then grab onto this, okay?
Okay.
Ready? Count of 3. 1, 2, 3. Okay, and then you can grab on here. So then you'll just do the walker first and try to set all 4 down at one time.
Okay.
And then, yep, take a couple steps. And then walker, all 4 down at one time. Does that feel tough to walk?
No, just
Okay.
slow.
Scale of 0 to 10, how tough? 10 being like, oh my gosh, this is terrible.
It's not bad.
Okay. Let's go around one more time. You're doing good. Does it feel good to kind of stretch your legs out?
Yeah. Feels good to stand up.
Okay. You're doing good. That's very, very promising. Now, do you have any, I know you don't use a walker at home or a cane. Do you have one at home?
No.
Nope. You can go ahead and take a seat here.
Okay.
And so back right up to the chair. And then reach for the chair. Both hands. There you go. Okay. So, I'm just going to look at your telemetry for your heart rate and blood pressure. Or, sorry, your heart rate and your pulse ox. But I'll still take your blood pressure. So that is 108/64. So it did drop a little bit. It doesn't concern me too much for not having moved, quite so much in the last 24 hours and kind of being fatigued. And we did walk a little bit more than we originally anticipated. So that's not too bad. Oh yeah, I'm gonna look at this actually for your heart rate. How's your pain right now?
It's fine. I don't have any pain.
No pain. Well, that's good, right?
Yeah.
Your heart rate just went up a little bit, 78. Your pulse ox stayed the same. So, very good. We're just going to head back to the bed, and then I'll have you sit down. I'll take him one more time, and that sound good?
Okay.
Okay. So, when you sit up, remember to push off of the chair and then reach for the walker.
Okay.
1, 2, 3. There you go. I'll take a few steps. Alright, now we can head right back to your chair, or sorry, your bed there.
Okay.
And then I'll have you back right up to the bed.
Okay.
Yep, there you go. So back right up. And then make sure the back of your legs are touching the bed.
Yep.
And then reach for it with both hands.
Okay.
Okay, there you go. Okay. So I'll take your gait belt off here. Do you think that you would walk more at home if you had an assistive device? Like, are you kind of fearful of falling at all, or?
Maybe, I don't know. I guess it depends on the day.
Okay. All right, I'm gonna take your socks off here. Okay. So I know you want to get discharged home. Your vitals are very stable, so that's good. That's a very promising thing. You're able to move. I am kind of concerned at this point of you walking without a walker, just because walking seems to be getting progressively more difficult, and then also with having, this laying down in the hospital and that sort of thing, being immobile for 24 hours, I would be a little hesitant to send you home without anything. So I'm going to talk to your doctor about when he plans on discharging you. If it is in the next day or two, I'm going to suggest that he sends you home with just a standard walker, something that you can use at home. And if not, then if he doesn't, if he wants to keep you here for a couple days, then we'll kind of reevaluate each day.
Okay.
Does that sound okay? Is there anything else that you want to know about going home?
No. They'll take me still probably to dialysis. I'll probably have to call them.
Okay. All right, so we'll kind of take it day by day, and I'm going to take your vitals again.
Okay.
Do you have any questions?
No.
You're doing well. I wouldn't be surprised if the doctor did send you home, but at the same time, you'll be back for dialysis, so maybe he'll keep you until that point, just to save you a little bit of hassle, but we'll see. We'll kind of see what he's thinking and plan around that. Then give me your arm. (112/64). So that top number is going back up.
Okay.
That's good. Then I'm going to check out your monitor again. Do you have pain at all?
No.
You still don't have pain. Okay, that's good. Okay, everything stayed the same here. Your Pulse ox is still 98. That's normal. And then your heart rate still stayed at a steady 78.
Okay.
Do you want to lay down, or would you rather just sit, or do you want to sit in your chair?
I can sit for a little bit longer. It's nice sitting up. It's fine.
Okay. Do you want me to take your gown off, or is that keeping you warm? What do you think?
I'll keep my gown on.
Okay.
I think.
I'm going to give you this. That's a call light, so just hit it if you want to lay down or need help laying down, and the nurse will come run in, okay?
Okay.
Let me make sure I got everything. Okay, so I may see you tomorrow, but I'll talk to your doctor and we'll see, okay?
Okay.
All right, it was a pleasure meeting you, and
You too. Thank you.
you're welcome. Enjoy the rest of your day.
Thank you.